About 1 in 5 people develop cancer in their lifetime. Approximately 1 in 9 men and 1 in 12 women die from the disease. The World Health Organization (WHO) said that the number of new cancer cases globally will reach 35 million in 2050, 77% higher than the figure in 2022. India reported 1.41 million new cancer cases in 2022. Breast cancer ranks the highest. You and I, each one of us, needs to plan for the C affecting at least one family member in our lifetime. This is Quick Take, your quick guide. I am Smita Prakash. The International Agency for Research on Cancer (IARC) has some shocking information based on data from 185 countries and 36 cancers. There were an estimated 9.7 million cancer deaths in 2022. Globally, lung cancer most common, followed by breast, colorectal, prostate and stomach cancers. The rapidly growing global cancer burden reflects both population aging and growth, as well as changes to people's exposure to risk factors, several of which are associated with socio-economic development. Tobacco, alcohol and obesity are key factors behind the increasing incidence of cancer, with air pollution still a key driver of environmental risk factors, the IARC said.
Tobacco remains one of the biggest public health threats the world has ever faced, killing an estimated 8.7 million people every year. The economic, social and environmental costs are massive. About $1.4 trillion a year in health expenditure and lost productivity.
The most developed countries are expected to record the greatest increase in case numbers in the next 20 years. But in terms of percentages, the least developed countries will see the greatest proportional increase, up 142%. Countries in the medium range are predicted to record a 99% increase. The burden on health sector of countries like India is going to double in the next couple of years. Policymakers need to factor this in mind. We simply do not have enough cancer care hospitals or oncologists to deal with the number of patients who will need care in the coming decade. The goal of public servants should be to ensure that everyone has access to affordable quality health services. This must not just be a resource issue. The private sector will have to make it mandatory to invest in cancer care of their staff. Early diagnosis and screening of cancers will go a long way in reducing cost to company and even to the families of the employees. There are more than 100 different cancer types, but the top 5 cancers account for about 50% of cases. Screening for these cancers can be done easily in India. Women in lower developed economies are 50% less likely to be diagnosed with breast cancer than women in developed countries. Yet, they are at a much higher risk of dying of the disease due to late diagnosis and inadequate access to quality treatment. In developed countries, 1 in 71 women die of breast cancer. In less developed ones, 1 in 48 die of breast cancer. Who should go in for cancer screening and when? Cancer screening is recommended for individuals based on factors such as age, gender, family history, and personal health history. Guidelines may vary depending on the specific type of cancer. Consult with your healthcare providers. Regular checkups and open communication with healthcare providers are key components of cancer prevention and early detection. How you can plan your medical plan for yourself or family members for a situation if C hits is: build an emergency fund. Find an insurance plan that makes it easy for you to access funds. Buy supplementary insurance for spouse, children, siblings, and parents. Set aside an emergency fund from the day you start earning. Learn to negotiate medical bills. Get a financial consultant on board if you're not familiar with data. And most importantly, stay informed and proactive. Thank you for watching. Jai Hind.